So how did I find out I had a heart condition? That was a pretty scary moment. I had fainting spells from the age of 10, and then around the age of, I would say 17, I would have fainting spells, but my heart would have rapid palpitations. So it wasn't until I was 18, I went on a date, and I probably was overly excited, and I had another episode, and that time it lasted really long. And by the time I went into the hospital, my heart was beating 240 per minute. I didn't really get the severity of my condition when they told me I had cardiomyopathy. It wasn't until I got the pacemaker, the defibrillator in my body, and I saw the scar that I associated, okay, I have a condition. There's something wrong with me, and that's when the emotional piece of it started happening.
I'm Dr. Victoria Parikh, the director of the Stanford Center for Inherited Cardiovascular Disease. Here at SCICD, we take care of patients and families like Sandra's, who have a genetic form of heart disease. Unfortunately, Sandra's story is all too common. As many as 1 in 250 people may have inherited a risk of developing heart disease.
The moment I met Dr. Parikh, I feel like I just met like another part of my family. She knows my whole history, she knows my dreams, my goals, and her and everyone has been instrumental in my being here today.
For many young people living with genetic heart disease, starting a family is a more complicated decision than it has to be. And carrying a pregnancy can be dangerous for patients with serious heart muscle diseases. Sandra was no exception.
When I first told Dr. Parikh that I wanted to be a mother, we knew that it wasn't an immediate need, but it was a want in the future. And so we did various tests where we would experiment where, okay, let's not have you on this medication and see how your body reacts. And let's do these tests and see how your body reacts.
At SCICD, our team works around the clock to bring better care options to patients living with genetic heart disease.
From the moment I let my cardiac team know that I was pregnant, they immediately connected me with the right team, and I said I want to continue with this pregnancy, and Dr. Parikh just nodded her head and was like, okay, we're going to do this. And so her and the OB team worked flawlessly together.
In addition to working closely with Sandra to ensure a safe path during her pregnancy, our clinical genetics research team worked together to identify the genetic cause of Sandra's cardiomyopathy, which helps us to understand the risk of this disease across Sandra's big, wonderful, loving family.
From the nurses to the doctors to the coordinators, both teams really delivered perfection. I didn't have to worry about anything, and I just had to focus on having this baby.
To continue providing cutting-edge diagnostics and therapy to the brave families who need it, SCICD needs your help. Every year, supported by Stanford Medicine, we hold the My Heart Counts event, a 5K, cycling event, and kids fun run to support our work. Every year, more than 1,500 people come out to Stanford University campus to participate, raising funds and bringing awareness to these families' fight against inherited heart disease. It's more important than ever to support genetic testing, education, and cutting-edge research for these families. We hope that you'll visit myheartcountsrun.org and sign up today. Patients like Sandra and her family need your help. We can do this together.